I have been involved in robotic surgery since the time it was first introduced in Malaysia in 2005, and this was the time I was working in Hospital Kuala Lumpur. Even now, 20 years later, whenever I perform robotic surgery, I'm still amazed by the uniqueness of the system. It affords a magnificent 3D imaging, and the precision of the robotic instruments is really quite remarkable. Now, prostate cancer has always been performed using conventional open surgery, and this has been the way since the last 50 years. Since the development of robotic surgery, the way in which we tackle prostate cancer has completely been revolutionized by this robotic platform. Open surgery, which was the gold standard, has been almost completely replaced by robotic surgery for prostate cancer. When patients come for surgery, what are their concerns? They want to know what are the complications, how is the pain managed post-operatively, how long do they have to stay in hospital, what is the length of recovery, and how fast can they go back to their normal chores and daily activities. These are all really important areas of concern, and in all these areas, robotic surgery does much better than conventional open surgery. Intraoperative complications are quite minimal, and in fact, blood loss is really very minimal compared to the open conventional surgery, and we hardly have to give a patient a blood transfusion. The average length of stay is somewhere between 2 days, and most patients are able to return to their routine, normal daily routine within 4 weeks of the surgery. In terms of functional outcome, that is to say sexual function and urinary continence, robotic surgery appears to be better than conventional open surgery. Sunway Medical Center was one of the early private institutions to acquire this robotic system. So robotic surgeries here started in the year 2019. Since then, we have acquired 2 robotic systems, and we now offer robotic services for the subspecialties of urology, gynecology, hepatobiliary, and colorectal surgeries.